Welcome to the Bedrock Way podcast, where we're changing the habits of yesterday by creating the new healthcare reality of tomorrow. Today's podcast title is Compassion for Our Heroes, Veteran-Centric Healthcare Training. And my two guests today, Levy and Elliot Cohen, they're longtime colleagues, they're longtime confidants. I see them at every conference, and they're my two work colleagues who, when I see them, we can go months without seeing each other, and it's like we just saw each other the day before. They're predictable, you know what you get with them, they're consistent, and they show up. They show up when it counts. So I wanted to start off a little bit about informing the audience of a well-known stigma, and that is the way that veterans receive healthcare, which is very poor in today's, unfortunately, healthcare that tends to underserve those who need the most services. And just doing a little research on why veterans are treated so poorly in healthcare, there are 6 reasons. And I want to get your take, Jen and Elliot, before I introduce you guys on how you feel these 6 takes, because obviously you guys are experts in creating a training program so our veterans get better services, and we'll talk about more during this podcast. Number 1, we have an overburdened system, right? In some countries, the healthcare system for veterans may be overburdened, leading to long wait times. As a result, a lot of our veterans, as we know, do not even access the VA network. They go outside of it because of the long wait period. A lot of veterans also deal with complex health issues. They've been exposed to physical injuries, mental health issues, and PTSD is really rampant with our veterans. Also, transitional challenges. It is one of the hardest transitions to make is going from military life to civilian life. And that often has veterans navigating a very difficult healthcare model. Number 4, limited specialized services. Number 5, the mental health stigma. And number 6, probably one of the biggest ones that we deal with, and I think I want to augment this today, is policy and funding issues. The government just doesn't provide the funding that is necessary for these veterans to get the care that they need. So let me introduce our guest, Elliot Cohen, Jen Levy. Welcome to the Bedrock Way podcast.
Thank you, Andre.
Thank you.
So let's start with you, Elliot. So tell me, why, in your opinion, do veterans get such poor health care nowadays when you would think that they would be the ones to get the best care based on the sacrifice they have made for our country?
From what I've seen and what I believe, it's a difficult navigational process for them. They don't know exactly where to go, where to turn to, and what exactly their benefits are. And if they had a better resource to those benefits and to what they're entitled to, there are a lot of good benefits out there for them. They just have to have the ability to get to it and have the right people guiding them.
Beautiful. Jen.
Look, as you said in your opening piece, healthcare is fragmented, whether or not it's for the veteran or any other healthcare seeker in our industry. And it's very difficult. Our veterans who have fought for our country, who have given the ultimate sacrifice, who are professionals and true, are experts in what they do, doesn't translate into the fact that they're experts into how to navigate the healthcare system. And our country, our healthcare system as a whole, doesn't do a good job of connecting those dots across the continuum, whether it's for our veteran or any other person seeking care. And I think that's really what has driven us and what has given us that impetus to want to make it better.
It's incredible to me how ignorant the healthcare industry is to the fact that we're dealing with a very special population. And today we're going to talk about a Valor education and training, which is a program. And I want to say more of a movement. It's a movement that you guys have started. And it is a way to train caregivers to allow them to have a better bedside approach with veterans, so that they can connect better, so that veterans can adhere and comply to the recommendations that are being given by healthcare, right? But why is there so much ignorance, and why are you guys the only ones focusing on this in the market?
I think, Andre, that people just don't understand that
Clearly.
you've got to have, and the Department of Health in many states, especially here in New Jersey, have a focus on what they call patient-centered care. So they've really got to understand, and the staff need to understand who the individual resident or patient is. They currently don't. They go about doing their job as they've been taught how to do it. And it's important to really understand who you're working with and who you're dealing with so that you can give them the best level of care. When you go to see a physician, you want to have that interaction with that physician, and you feel comfortable.
Sure.
But a veteran has a difficult enough time opening up and sharing where they're hurting or where their issues are. So whether it be physical or mental, they can't express themselves in this world.
Some of the highest suicide rates, right, are with some of our veterans. To me, there's been such a long-term cry for help. And why has this cry for help not been answered, Jen?
It goes back to the saying, until you've walked in someone's shoes, you truly don't know what they've experienced. And so you can read the books, you can watch what's on TV, you can have a 2-minute conversation with someone, but that doesn't mean that you can truly understand what they've been through.
And for them to open up is very difficult. Very, very difficult to open up. So even if you want to provide the best possible care,
Sure.
if that patient that's in front of you is not giving you the full information of what you need, you're never going to be able to provide that.
So it's giving providers in any of the healthcare continuums that are out there, whether it's community-based or in a post-acute type setting
Or
hospital setting, it's giving them the tools to know what to ask.
I have a tough time believing that it would be hard to get a veteran, right, to comply, because any veteran, they are taught obedience, right? They're taught to follow rules. They are taught to follow the chain of command. They are taught. That's why it's so much more, I think, sometimes convenient for a civilian business to hire an executive that has veteran training because they know how to follow the rules, policy, and procedures. So you would think that a veteran patient would be able to follow the rules agnostic of somebody knowing how to approach them or not, because again, adherence and compliance is something that is inherent in them because it's been drilled in them.
The other piece that you're missing that's been drilled into them is to not show weakness. And by having an illness or something bothering them, they're trained not to show that. They can't show that. If you were to walk into a room, and I use this example all the time, you could see in a hospital a veteran bleeding out, and somebody concerned, a well-intended staff member, nurse comes in and says, "Are you okay?" The answer is going to be, "I'm fine." They cannot show weakness. So just for all those other things you just mentioned, they're just as trained to not show that.
Wow. That's incredible. And again, to me, that compassion is what we need to show our veterans. I never thought about it that way, Elliot.
And the trust. And the trust level. They don't know you. Why would they trust you?
So the good thing about Elliot and Jennifer is that, I can't believe I called you Jennifer, Jen, is that they have a vast experience in healthcare. I'm going to go through their bios real quick, and then I want you guys to tell the audience how you guys came to this pivotal point of, again, pulling the trigger, developing a company that could be a national servicer of this potential need. And you guys have a tremendous passion behind it, and I want the audience to feel this. So Elliot Cohen is the president of New Era Health Associates Corp., has been a consultant to the healthcare industry for the past 15 years. He is the founder of New Era Healthcare, which provides consulting services to the long-term care industry, including census building, marketing plans of new facilities, purchasing software and hardware implementations, product development, recruiting services, financial services, and many other types of services to increase efficiency in operations. He has overseen the New Jersey Department of Health mandated directed plan of corrections. I'm sure you're a popular guy in those skilled nursing facilities, and mandated oversight of multiple healthcare facilities in the state of New Jersey over the past 15 years. It included administrative and clinical requirements as a temporary manager receiver. Elliot is a certified dementia practitioner, CDP, and personal care home administrator in Pennsylvania, and has been approved as an expert witness in the healthcare industry. I like it. Jen graduated with a bachelor's in sociology with a concentration in healthcare services and a master's of social work. She's a licensed social worker and a licensed nurse and home administrator with over 30 years of experience. You don't have 30 years of experience, Jen. Did you start when you were 10? She spent the first part of her career working as a licensed social worker in skilled transitional care and home health settings. And Jen actually grew up in the business. Upon obtaining her administrator's license, Jennifer worked as a licensed administrator and regional director of operations in the private, for-profit, and not-for-profit sector. In 2005, working for her family-owned skilled nursing facility, Jen assumed the role of VP of operations, taking all those headaches. But she took a 246-bed skilled nursing facility to be the top skilled nursing facility in the region. Based on her work over that time, Jennifer sat on the state committee to revise the Universal Transfer Form and regulate education for New Jersey healthcare providers related to this initiative with the New Jersey Department of Health, the New Jersey Hospital Association, and New Jersey Healthcare Association. Jen currently owns and operates J. Levy Consulting LLC, which provides consulting and operational oversight services to the healthcare industry. Jen and Elliot, together with Nellie Stolars, started last month Valor Education and Training to advance the standard in healthcare and education and training for our veterans. Elliot, tell me, what was the impetus for you to do that? You have a tremendous experience. You could have continued to do very well, by consulting with all of the Department of Health mandated directed plans of corrections, but you obviously pivoted in your career that this was a need that presided over what you're doing now. Tell the audience why.
So by being involved in a lot of those directed plan of corrections, getting to see what's gone on inside the buildings on a day-to-day basis, I was sitting one day at an event, listening to somebody speak about, again, veterans and how to better care for them, and they need that assistance. And I'm sitting there thinking about my grandfather, who was a veteran, and him, and his experiences, and it started to really click in my head that, we've got to do more. And what we've got to do is find a way, because I couldn't penetrate the conversation with my grandfather and get stories from him. I remember maybe one or two stories from him, but I just couldn't really understand why he was so strict and rigid and hard to get that relationship with. And it took a long time, which eventually developed, but there's got to be a way, I felt, to helping veterans and helping the families and helping, especially now in the industry we've been in for so long, how do we better educate staff? And not just the nurses' aides, the nurses, and the frontline staff, but all the ancillary people to better understand.
And make it veteran-centric.
And exactly look at veterans from their perspective, and be cognizant of what they're doing in their jobs to basically see the person in that bed or in that wheelchair for who they are and what they've been in their prime, and get them back to that level.
I could tell, Ellie, by the way that you're expressing yourself, that there's a visceral reaction for you to explain the theory behind your mindset of doing this. Do you feel regret with your grandfather? Do you feel that woulda, coulda, shoulda? Is there a Monday morning quarterback aspect about you where you hindsight and say, maybe if I could have done this and that, things would have been different? Because I could tell that this is something that's moving you emotionally.
I remember seeing him at the end of his days. He unfortunately had mesothelioma, and was on a vent in a nursing home, and the care that he got was terrible. Even though he was on a vent, he was fully cognizant of what was going on around him. And I remember getting a call that something went wrong, and went in to see him, and I said, Grandpa, I'm going to say something about it. He's like, no, don't say anything. Let it be. What, they're gonna retaliate. I don't want to bother with that. But I did happen to know the administrator very well, being that I was in the industry.
Sure.
And I did go to the administrator. It was taken care of. But why shouldn't, just because that happened to my grandfather and I'm in the industry, I can't even imagine what it would be like for others who don't know how to navigate the system. So there's the passion for wanting, look, I was able to do for my grandfather in his time of need.
Sure.
But why not find a way to be able to do for more than that?
Love it. Love it. Jen?
Very important mentor said to me and taught me that men build too many walls and not enough bridges. And you mentioned in your opening bio about myself that I grew up in the industry. And one of those things that have stood with me throughout this time is I've learned how to connect the dots, how to push the gauntlet on things, how to maybe make some unpopular decisions or delve into different programs that don't exist that maybe you think would never take off, but you've got to try. And the impetus for me when Elliot brought this up as this idea, which initially I was like, there's no way we can do this. This is like a pie in the sky idea. But he was absolutely right. And I had to go back to what that mentor, who was my father, told me and taught me that, look, you may have doors shut in your face. You may have people telling you, no, you can't do this, or the idea is too grand, but you've got to try. And you've got to make it happen. And I think, like Elliot said so eloquently, we need to give back. And this is our way of giving back to people who have sacrificed and who have done so much for our independence and our freedom. It's really this, what we've developed is a differentiator in the market and in healthcare, and it's really going to transform the way that healthcare is delivered and the way that our providers are able to deliver personalized care for all of our loved ones that are out there.
So Ellie, you mentioned that, especially with your personal experience with your grandfather, that there was a shell that he had emboldened himself around that kept you from penetrating and really getting to identify and empathize with him. How is your training penetrating that with veterans?
So the goal was to give caregivers the tools and the pieces of the puzzle that they may not know or may not see, where in one of the modules that we have in the program, it talks about questions to ask. And by asking questions, it will help and goes back to what I was saying before, where they don't trust, they don't open up so quickly. If you could start asking the right questions, they start to say in their own minds, hey, they're talking my language.
How do you know what the right questions are?
So in our developing the program, we've worked with veterans to see and to get their view and what they feel.
Give me an example. Give me an example of a question that I would ask that would need to be changed into an embrace and engage in way that a veteran would.
Well, the first one is, what branch of the military were you in? From there, maybe talk about their rank, what they went through, if they were.
Why is that important?
Because it builds trust. If you can discuss, and just like in the rest of the population, if you could build a rapport with somebody based, I was told when I started in sales, very simple, and you've probably heard it as well. When you walk into somebody's office and you want to sell something to them, you got to build that rapport. How do you build the rapport with somebody you don't know just by walking in their office? The way you do that is you look around the office, you see something, you spot a picture of them and their kids, you spot a picture of, them playing golf, you spot a picture of their favorite team. If you're knowledgeable enough to talk about that, you're going to start building that connection with them.
And this is their identity. Their rank, their title, their experience, that's how they identify themselves, whether they are active duty or they are a retired veteran. They are still always that person.
Once a Marine, always a Marine.
So one thing, and I understand that, and I appreciate the clarity. One thing that concerns me is the fact that we have a population that continues to be less and less socially competent, less and less socially efficient. And the reason that the research gives is that the phones, social media has made us very, we've lost a lot of interpersonal skills because we tend to just be, on electronics. How does the program challenge that? How does the program circumvent that, maybe is the better word? Because I worry about, we have caregivers here, right? We have caregivers in our home care. And the number one problem we have, Elliot, is their phones. Put your phone away. They're oftentimes talking to the patient or client and not making eye contact. If we're talking about trust. Trust starts with eye contact. Mm-hmm. Trust starts with being able to see the people's mouth move so they can interpret the words if their hearing is not there. So I want to hear how your program is challenging those things, because again, I think this is something that, forget veteran-centric, this is patient global centric. If we're able to communicate and teach the culturally competent current caregiver to be able to identify with that veteran. So tell me how the training does that.
I would start by going back to the fact that giving the tools of the right questions to start off with, people are not used to that now. People do, as you say, go to their phones. They're not looking to get that interaction. But if we can implement or utilize this to implement systems within facilities, within the hospital networks, within the home care agencies, and to differentiate them and say, look, we need to get to know them. You need to put that.
So let me rephrase the question. So is the program being granular in the way that we are training the caregivers to go step-by-step approach with anybody who's a veteran? The reason I'm asking is this. This is, I know the program will focus on veterans. This will make a caregiver a better caregiver, period.
Absolutely.
And you hit the nail on the head. Think about it. Think about the young demographic that's out there now. How many people can say that they sit every evening at the dinner table and have dinner together as a family and actually have conversation, to your point, without your phone, and learn how to interact and talk and have a difficult conversation or ask questions as simple as, how was your day? Tell me how your day was. If those conversations aren't happening in the home from a younger age to current, how do we expect our caregivers to come into an environment where they have to interact with a patient, whether they're a veteran or not, and have those conversations? You talk about customer service, the fundamentals of customer service. We expect our staff, any staff, to provide exemplary customer service. Some of that is ingrained in who you are by how you're brought up. So back to your question about our training and what does that do? It really starts to arm our caregivers with those fundamental tools of how to hold a conversation. What questions should I ask? How do I say it? How do I look at somebody and say that? Because, again, it's not a joke, but I kind of, make the joke, when I do education in general to our caregivers, and I say, how many of you, the moment you see that difficult family member or that perceived difficult family member coming down the hall, all of a sudden have to answer 5 bells that are going off? All of a sudden you're busy. You weren't busy 5 minutes ago, but you see that family member coming in and you're like, I don't want to deal with them because I know they're coming and they're going to be very upset with me, and I don't know how to respond to it. giving them the tools. How do they respond? And that's some of the things that we do, is we break down those possible scenarios, in this case for veterans, and how does a housekeeper interact? Because our housekeepers are in the room oftentimes more than other licensed professionals that care for a resident.
I think that the social efficiency, anything that improves the social efficiency, especially as we have a post-depression traditionalist being treated by a millennial, Generation X, who, again, you're talking about culture clash. We have a young population who is the caretaker, who is the caregiver, who at times they don't appreciate the fundamentals. So does the program, the training program, entail a competency that holds accountability, to that training, right? Because I can get the training and then go and just do my thing, right? Just go back. Maybe I do it because I'm being forced to do it, but then I go back. How does the program ensure that this is a long-term solution and not a flash in the pan?
So one of the things, and we've certainly discussed this many, many times, the facilities that we deal with, a lot of them have veteran contracts with the VA. And we'd love at some point for the VA to maybe take our program on, or say, guys, if you want to have that VA contract, you've got to have your staff trained and certified to be able to do it.
No question. I mean, education is longitudinal. This is a long-term fight. But Elliot and Jen, we have the Department of Veteran Affairs in Virginia. We have the Veteran Service Organization. We have the Wounded Warrior Project. We have Give an Hour program, Veterans Health Administration, Military One Source. You mean to tell me none of these guys? Oh, I'm sorry. We have Center for Deployment Psychology, Cohen Veterans Network, Operation Mend. All of them are geared as organizations, both government and non-government. And they're actively involved in efforts to improve the care and well-being of our veterans. You mean to tell me that these 9 organizations are not addressing these needs?
What I'm suggesting is that they're looking at things from a higher up level perspective and saying, yes, these things might have to get done, but nobody's, as Jen says, has bridged those gaps. Nobody's pulled it together to say, hey, look, this is a program, we need a program designed that's going to explain and give them the roadmap that needs to be done. We sat with the CEO of a state veterans home who looked at the program and said, wow, this is something that I've never seen. There are things I've learned from it because we do go into a lot of the exposures that they've been through. And he didn't even know about some of them. And he has been the CEO of that veterans home for over 20 years. He said he gives every staff member that comes into their building 20-minute, 30-minute overview of the military, but that's all they get when they walk in the door. And that's at your state veterans homes.
So can you give me a little bit, just now that we're getting in the program and more of the mechanics of it, can you tell me the length of the program, the framework, and dare I say the syllabus, right? Where these are the areas we focus on, this is the length of time that it takes for the program to go through, and this is, and I'm sure there's a pre and post competency to make sure that you've absorbed the information. So walk me through the specifics of the program.
So it is a 6-hour course. It could have been a 40-hour course. The first certification program we're doing is a 6-hour course called Essentials of Veteran-Centered Care. And for that, somebody would become a certified veteran caregiver specialist. It starts with the different branches of the military, explaining what they are. It goes through to the next module would be the wars and conflicts. It gives the staff member real education, a higher level education of the different conflicts and wars that these people have been through.
The traumas that they've
Traumas,
experienced.
exposures.
LGBTQ and how that impacted the military, recreation, and kind of how the operations impact in post-acute care and healthcare facilities. And we go through each of them methodically, high level. The first 6-hour course is pretty much high level, and each student each person being trained gets a resource guide, because there's so much information you can't possibly retain it all, but there is something for them to go back to. We really want them to understand the culture, the journey that the military professionals have been through. And once they complete this 6-hour training course, there's an application that they're going to need to fill out.
They'll fill out the application, upload their, training certificate that they went through the class. There are some other pieces on the application to kind of see their background and what they, and their experiences.
So it's not a one-shot education, which is actually something you kind of had alluded to in one of your previous questions. It's ongoing. We're providing them ongoing education so they continue to grow professionally. They continue to learn more skills on how to care for that veteran.
And part of that requirement within that 2 years is for them to attain additional CEUs to make sure that they're getting updated trainings. We are going to be coming out with more certification programs and more advanced certification programs. One might, eventually be on just activities focused for them.
Who's eligible for this?
Any staff member in a facility, medical practice.
Is there a minimum hours of care that you need to present before you go through the course?
No, because we've got, in working with other programs out there for education and certification, we've found that a lot of them are all focused on hands-on caregivers. And the reality is, and it just doesn't work well that way. Everybody needs to be trained, from the receptionist or security guard at the front door, because they're the first interaction.
Do you need relevant work experience in the field to take the course?
There is relevant work experience and criteria.
An accountant go
You
take
have to
the
have a GED
Yeah,
minimum.
Anyone can take the class, but in terms of getting certified, there's some additional requirements that you'd have to have, and we'd want that obviously to be within the healthcare field. Okay, but even a housekeeper within healthcare, we want them to have the tools to be able to provide care. I remember walking through buildings and on a dementia unit and just watching a resident about to have an episode where I see a housekeeper walking past them, and I'm thinking, what if that housekeeper just said, "Good morning, how are you?" That would calm the resident down, and it wouldn't escalate to get to the point where nursing's got to get involved and then creates a whole big ordeal. If we could get everybody involved in patient care, and it goes back to what you were saying before, is that this will help in every aspect, not just for veterans.
What a novelty. What a novelty to have people take care of others the way that they want to be taking care of themselves. Participants. So how are you guys procuring participants currently for the training?
So we've been working and focusing more on working with organizations that have veterans within their buildings, different nursing home companies, different assisted living ventures, home care agencies. We're taking the approach of working with the group perspective rather than the individual.
Is there an opportunity for you guys to become just almost a standard into their onboarding hiring process?
So interesting that you asked that question. One of the organizations that we're speaking to right now has a CNA class or course that they are vetted to be able to take or to give. One of the things that they would like to do is every CNA who is now getting certified through this program, through their organization, will also take, as an adjunct, the 6-hour training course and become certified, because they believe in it foundationally, as we spoke about before. so that they're armed already with that patient-centered care philosophy and foundation.
In that case, you guys can almost go from a training breeding ground to job placement. You can start placing people who just have a different way, or I should say an enhanced way of taking care of patients. That to me would be, incredibly, I mean, if I'm a nursing home owner, home care owner, whatever, private practice, anything, and you tell me you're gonna give me somebody who has, the ability to not only communicate with a veteran, which is again, a very specific population, but almost have the awareness to take the social blinders off and just be a better colleague, I'm going to be like, where do I sign up?
Andre, we're just scratching the foundation. You got to start somewhere. We can't be all things to all people day one, although I'd love to be. We got to start somewhere. But what I can tell you is that we have had so many conversations with other veteran healthcare nurses, people that are in other veteran organizations, that when we present this program to them, not just to get their feedback, but from a training perspective, they come back to us and say, oh my gosh, I see an application in what I'm doing now with this organization, and I can take it and implement it and really enhance the care that I'm providing currently to my co-veterans that I'm caring for. So what we really see is that this is going to become a domino effect, that it's really going to be a disruptor in the industry as the word gets out, as people begin to get certified, as other trainers who are from, are veterans, the passion behind it, and I think the value and ultimately the care that's provided in the outcome is just going to disrupt the industry, and it's going to become contagious.
So listen, that sounds all fine and dandy, but nobody gets in a car aimlessly without a destination. There has to be an ultimate plan here, right? Telling me that you got to start somewhere, okay. But I want to know, what is the ultimate plan that you guys have for this? Because this has a lot of universal applications. And when something has a lot of universal applications, you know what happens? That traffic gets so big that you get lost and you stop. So there has to be more of a tunnel vision, right? Every visionary has, they work from the end backwards. There has to be an ultimate vision of where you want to take this. I'm going to give you my vision. If this was my baby, this is what I would do. I would make sure that this becomes a veteran-centric application that is global, because I think it's lacking not only in veteran, but it's lacking in patient care across the board. And then the applicability of that could be anyone who provides care to a human being will make your market share a human being with a pulse. So what's the ultimate plan for you guys to take this? Because I'm a believer. Guys, I'm a believer. Everything you're saying, I agree with. I'm trying to get my head around, I'm sure the audience is, into how you guys plan. What is the ultimate plan? How will this look like in a year, 2, 5, 10?
The main goal of the company is to be an education and training company. We want specific programming. We're going to develop and work on our programming and train people who are then going to go out and train it. We're not going to be focused on going out and we'll help those people how to market it and how to train on it, but we want to focus on the content and make sure that that content gets delivered the way it needs to be.
Caregiver education is not new to you guys, right? So what are the weaknesses of the program that you guys foresee? What are the challenges that you guys foresee?
So there are going to be a lot of different trainers that are training this program. And we can train somebody how to train, how you envision things being presented. But as I'm sure you know, you can't ultimately control the individual training it. It becomes a very unique experience to how that trainer presents their information. So as you know, when you go to any CEU presentation or any other type of presentation, the presentation's honestly only as good as the person presenting the material that's there. We're confident in the material that's there. It's a very cohesive presentation, for lack of a better description. But the key to any education and somebody really embracing what's being taught is the person that's delivering the message. Every trainer has to earn by going through our training certification. So it's not just a job interview and then here you go, you can go out and train. There's a whole certification program on top of actually taking the actual
6-hour class.
certification.
They've got an additional couple of hours that they've got to go through.
Where can I go? Where can my listeners go and find out more about Valor? Because to me, this is, the last 45 minutes have been very eye-opening, and I'm like, I want my staff to get this. How do I start the process of getting my teams to understand this?
So we do have a website. There will be training classes posted up on the website, Valor Healthcare Training.com. Right now we've just we've put a lot on there in terms of the 2 certifications, which one is for the Certified Veteran Caregiver Specialist, the other is the trainer. And we are constantly going to be adding to it. We'll be doing some webinars on there as well. We'll have things up there for family members to see, some tools for families. There's going to be, we want to make it a resource.
One-stop shop to be able to find and have access to information.
Who's your target audience? Your prime target audience?
The prime target audience that we've focused on was the long-term care industry, the post-acute market. That is where our experience is. That is where we've been in the trenches on, and where we have some very strong relationships where we know we can make an impact.
What is the average age of a veteran?
It's
That's
a tough
changing.
one. It's changing. It's getting younger. Look, the exact numbers in terms of what's still left from World War II is diminishing every day. But yet you have veterans that are, coming out of the war with Iraq. And they're struggling now. So I couldn't give you an exact number on an age, but it is getting younger. The population that is going to have to be worked with and handled and dealt with and cared for and given that comfort and that respect is a younger population.
So 60% of the current veterans are 20s, 30s, 40s, 50s, and the least amount, 60s. Your Vietnam War, Korean War, World War II veterans, very low amount. So is your post 9/11 veterans, right? So those are the ones that we're going to have to face. And the reason I asked that question is I think would be short-sighted to say that long-term care is the goal where only 15, 18% of our target audience is there, right? It's that younger population that sometimes are caregivers themselves. So I think in training, in being able to get your market share and target audience is probably a veteran, since they're in the 20s, 30s, and 40s, and I'm assuming a lot of them are still working, right, potentially, is veterans who are wanting to take care of other veterans. Is that something the program also focuses on?
So the core program doesn't focus on that. It focuses on history and background and an understanding and tools to work with.
So it's not framed to teach a veteran to take care of another veteran because a veteran knows a lot of those things.
Right. So, okay. But on it's interesting you say, because on the trainer side of things, we want some of these younger veterans that are coming out now to be able to come into, our window here of opportunity to be able to give them that path to be able to care for other veterans.
Any last words from you guys? Listen, this has been very eye-opening. We've talked about, the length of the program, what entails the ultimate plan, the incredibly flexible applicability of the program, the eligibility, how participants can join, valorhealthcaretraining.com, that's the website. Plenty of a repository of information. I just went and looked at it. What are some last words? What are some last words for our audience? If you want the audience, or I should actually say, if you could go and fast forward a year from now, right? So a year from now, November 30th, 2024. How will Valor look like a year from now, Elliot? And then I want to hear from you, Jen.
What I envision seeing is the level of care in the facilities going up, the level of care not only on the long-term care, but hospital, home care, different industries or different parts of the healthcare industries being able to provide the services that are needed and the care level and the staff in the buildings to have that understanding.
And the ability for them to measure that.
The communication, to be able to have that communication, empathy, and gratitude. Okay? Giving back what they deserve, caring for them the way they need to be, but also, since that population of veterans is younger, some of them are not going through, as you said, going through that system, the long-term care portion of the system, the post-acute, but helping them establish a business. I want to be able, I know how difficult it was also for my grandfather to have his own business, which he did have. But if we can give back in that way and see veterans thriving by teaching, by being out there, I think that'll spread the word too that they deserve that respect and they deserve to have that. And seeing them make their own living in their own self-worth and seeing that and believing it, I do honestly, and again, I'm not a medical doctor, but I could tell you from what I've been through, I can see that potentially helping reduce in one of the biggest problems of veteran suicide.
I agree. What's your grandfather's name? What was your grandfather's name?
Leonard Bedell.
Why not name the program the Leonard Bedell Valor Training Program?
Because each of us have veterans in our family, and we could not come up with one name to encompass all of it, other than.
But it seemed like your grandfather was really the catalyst.
He was
ignited
part of that
fire inside you.
He was that catalyst for me. So I will say this: in our partnership, there's the three entities that own the company. He is within mine.
That's awesome. Jen.
A year from now, to be able to hear from other veterans and other families of veterans say that this program has made a difference, somehow has impacted their life in some way, it is, to me, one of the most meaningful things that I think personally I could get out of this, that we made a difference, that we impacted some way the healthcare system to give back and to provide and elevate quality care, where a veteran can come into any level of healthcare organization, take a deep breath, and say, you know what, I feel comfortable. I'm confident that my healthcare provider, regardless of who they are, understands me, understands the journey that I've been through. You know, can be more empathetic, not sympathetic. Big difference. And walk out of there feeling valued and that they're getting what they need throughout the healthcare system.
I will tell you guys one thing, and I'm going to do a confession. And I've known you guys both for a long time, and I'm going to focus on you, Elliot, and then Jen. And just the emotions that I've seen in the last hour or so from you, Elliot, I think it's we always talk about our doing things in life that gives us value, purpose, and meaning. And sometimes people work because they need money for a purpose, or justify a means. I could tell that this is your mission, and I can tell that this is your legacy. And I got to give you credit. I think you're making Leonard's legacy valuable, and just seeing your emotions, and I feel your energy. I think you're doing this for every veteran that's out there, for them not to spend their last days like Leonard did. I see the passion, I see the valor. in the way that you develop the information. And I got to be honest, I've seen a different side of you today that I like, very real, not that you're not, but sometimes when we're in conferences, sometimes when we're, happy hour, sometimes when we're in the social water cooler settings, you don't get to see, the real people, right? Because the real people come out when there's vulnerability. And I could tell this is something that makes you vulnerable. And usually, the things that make us vulnerable and weak bring out our biggest strengths. And I can tell that in you. As you talked, you started the conversation very nervous, but you got into your wheelhouse and got very confident very quickly. I commend you for this. This, I don't think, is an easy feat, by the way. This is going to attract a lot of naysayers who say they can do it themselves. This is going to attract a lot of people who say, what do I need to pay these guys to do it? We can do that. It's common sense. But I think if I can give you a piece of advice is, sell it the way you presented it here. And you will have a exorbitant amount of business. The genuine belief that almost brought you to tears, telling me the story. And I could tell that as you're talking about Leonard, it almost brings you back in that hospital bed, seeing him on that vent. And to know that there is an internal motivation for you to make sure that that episode never replays itself again. I commend you for that. Jen, and again, I love the fact that you are involved in this, because I really think that you guys can disrupt, and that was the right word, disrupt the industry by actually championing something that almost has been lost and has been relegated as unnecessary. But yet it continues to be a tremendous need. You guys are very talented. You could have done anything probably in the field, and you guys have been doing very well with your own companies. But I guarantee you this will allow your present businesses to grow to unprecedented heights, because this is a need that, quite frankly, every single client patient that's out there needs, whether veteran or not. You start with the veterans, but my goodness, your endpoint could be anyone with a human shell and a pulse, which there's plenty of them out there. Guys, thank you so much for being part of the podcast. Thank you so much for being here, and I appreciate you guys. And I look forward to having you guys a year from now and telling us here at the Bedrock Way how your path has grown from this point forward. And I'd be happy to support you guys. Appreciate you guys.
Thank you.
Thank you.
And we are changing the habits of yesterday by creating the new healthcare reality of tomorrow. Thank you so much. Appreciate you guys.
Thank you.
Great job. Great job. Awesome.